Hello, this is Dr. Flamenco from Helix Dental. Thank you for watching Digital Dentures with Vita Vigo and Alman Gerbach. Today we have a case that we'll be presenting on a patient that has an existing upper denture, fully edentulous, and lost their lower denture. Here you can see that we're scanning the upper arch and we'll shortly be scanning the lower arch. The upper took about 1 minute 44 seconds, whereas the lower was 1 minute 12 seconds using the Planmeca Emerald S. Awesome scanner. You'll see that there are some artifacts and some issues with the cross stitching due to the interarch relationship. That just depends on the scanning pattern and if the tissue was moving. That's something that we can go over another time. But for this case, you can also see that we're scanning the upper denture just to have a full record of it, 360 degrees. That way, in case we ever need to use it for a reference or to fabricate another upper denture by means of printing or milling, we can actually do that as well. So the best way to go about this case would be to take impressions of the upper denture to create a duplicate for articulation so that we can actually scan it, just because it is difficult to scan the bite using the upper denture and a wax rim with bite registration. So unfortunately, the software is not there yet, so there is a workaround on this. What we can do is pour up the model of the impression of the upper denture, take the lower impression as you see here, pour up that model, create two X's on the top and the bottom. That way we can match it within the software under Ceramil Mind, which is easy to do. You just make sure you get your points correct, and we'll show that shortly. So in this case, we have the upper and lower models out. We have our base plate with wax rim. We're going to get the patient into centric relation, place bite registration there to lock it into place. And we're also, for this presentation, going to have the patient take an application CBCT image so that we can get the sagittal condylar guidance angle. We're going to be using the CBCT data to create that angle, or to actually record that angle. And you can use your traditional methods of fabricating the denture as well. You can also scan both models in articulation in the articulator, depending on if you have an external scanner. That's another way of going around this. So here you have the patient. You can see the bite registration placed in the middle, and over here we're actually creating a Frankfurt horizontal plane by the inferior border of the orbit and superior border of the external meatus, and getting an angle from the crest of the articular fossa and the crest of the glenoid fossa. And you can see that it's being created right here so that we can actually calibrate that and get the correct angle. So for the left we have 50.5 and for the right we have 50.8. So those are the degrees that we're going to enter into Ceramil Mind when we get to the articulation process. Here you can see where we are matching the models, and we actually scanned the whole model with the bite registration in place, including the back wax rims with the base plate. And the more matching points you have, the better for the accuracy. In this presentation, I did calibrate it a little bit different right after this. As you can see, there's a little bit of discrepancy, and then there's a photo that I'm going to show right now after it's been calibrated properly. Took me a little while just because I actually saw a little error that I had there on where I had my placement for the points. But the more points, the easier it is, and you can see right there that that actually matched up very well. So then we're starting off with a denture, creating the occlusal plane, the vertical plane, and setting the teeth into the correct position, just following the occlusion of the existing upper denture. This makes it way easier. I mean, Vita did an awesome job with this. ExoCAD is amazing with this as well, so thank you to Alman Gerbach for pairing up with Vita on this type of project to where we can now create dentures digitally. So you can see we're orientating which direction we actually want to have the teeth in. We're actually mapping out the tissue as well, so that way we can actually create a proper base for this denture. Making sure that you actually get the retromolar pads are very important, just for the stability of the denture itself, and you can create the flanges to go lower if you want. It automatically has a block out calibration there that you can modify if needed. In this case, we have this patient with shade A3, so that was already pre-selected. When we chose the size of the teeth, we actually went with Vita Vigo L33 for the anterior, and for the posterior it was 21L. And you'll see pictures here that we actually compared analog versus digital, to where on the analog we actually have the Vita Pan XL for the anterior, and for the posterior we have Vita Lingoform. So you can see here we have the proper placement of the teeth in relation to the existing upper denture. And from the CBCT information, we can actually import that in as a STL file and make sure that we have the proper sagittal condylar guidance angle inserted into the movements, which you'll see shortly as well. So that way we can actually double check the occlusion. And here we're actually just digitally festooning the denture, which is awesome because you can do any type of modification that you'd like, to your heart's desire. Afterwards, you can also use material such as the Vita VMLC, which is more of a flowable type of composite. I usually use window. You can use different colors as well, to create different characteristics of the tissue. But honestly, you'll see right after designing this that the Vita Vionic bases that Vita has for the 98 by 26 and 30 millimeters are very nice. They have orange pink, deep pink, and light pink. Hopefully they'll come out with more colors available for the Ceramil Mind. So here you can see that we're actually moving the STL file that was exported from our CBCT into the virtual articulator. That way we can actually get a digital guidance for this. And we inserted on the left hand side 50.5 and on the right 50.8, and that way we can see how the occlusion is being affected during protrusive movements, lateral movements, retrusive movements as well. So once we're done with this, we have the options of printing everything as a monoblock or printing just the base without the teeth. In this case, we milled the actual base itself. And since we're using Vita Vigo, all we have to do is bond them into place. So here you can just actually modify the denture base itself a little bit more if you like. And just double checking everything just before we actually process it. So as far as the pucks go, I did notice that it depends on how high you're creating that retromolar pad towards the back. If you are going upwards, I'd say anywhere, if you can actually place this base when you're nesting and then see if you really need the 26 millimeter or the 30 millimeter. I barely made it with the 30 millimeter on this case, just because of the angle that the mill had to fabricate this for us. So we were satisfied actually with how everything came out, just based off of the placement of the teeth and actually the base of the denture. So we went straight to nesting after this. Now that we've digitally created using the distal ends, usually you would want to hold shift while moving them around, that we can re-angulate it or actually delete it and place it in a completely different position if you like. You can mill this in standard or fast. Standard takes about 3 hours versus fast, which would be an hour and a half roughly to an hour and 45 minutes. And you can see here that's what it looks like with the base, inserting the teeth without bonding. There's the occlusal view, and you can see we actually moved around the occlusion to make it look more natural. This is for the analog version, the Vita Lingoform and Vita Pan XL. So very nice looking teeth. I do like the Vita Vigo more, and you can see just on our digital festooning how this looks very nice. So once we bond, we actually want to place everything in a pressure pot for about 20 minutes. That'll help. And you can see here, just based on the density of the liquid, it's at 20 microns, which is awesome. You just have to lightly coat each socket and place the Vita Vigo teeth into place. Hold it for 10 seconds for each tooth. In this case, I placed all of them and then held it for about 10 seconds and placed it into the pressure pot at 30 psi. And I did that for about 20 minutes. So I made 2 copies of the lower denture. One was just so we can have a sample for the patients. And you can see here that it's just placed into the pressure pot at 30 psi. We wait 20 minutes and then we cured. You don't have to cure right away. You can actually place, and I did this a couple ways. You could actually place the Vita VMLC window around the edges and into the interproximal, so that way, you know, food doesn't get trapped in there, and then cure it. And I also used what was in that bag. It was actually glycerin, so I used food grade glycerin to actually seal everything to remove the oxygen inhibition layer when curing it. And this is the analog version. So here's the analog versus the digital. So with analog, look at the occlusion and the anatomy on the teeth. They look nice, but then here you have the digital version, which I do like a lot more. To me, it looks a little bit more natural. An analog version again on the underside, digital version on the underside. And on the left you have the analog, on the right you have the digital version. So here's the analog again versus the digital version. And you can see once again on the left analog, right digital. Here we can see the delivery of the lower denture that was fabricated in the lab. Those are right side, center side, and left side. You can see that the occlusion is a little bit open. The tissue actually matches the acrylic, which is awesome. Just that we have more control fabricating this case digitally, as you can see here with the digital case right in front of you. On the right, this is the center, and then the left, it gives it natural rotation, and you can actually arrange the teeth however you want on to the arch. So I am also going to show a video of the commentary. By the way, no adjustments were required for the digital denture. The patient was happy with the fit right when we placed it. Alright, so we have the analog denture here. And then, Omar, I was going to ask you again, so how did you feel with the digital denture?
It's perfectly fit, you know.
Perfect. So you feel that's more comfortable than the analog?
The first one.
Okay, awesome. So yeah, we just wanted to make sure, because I made sure, we copied all the tissue, that it fits really good. And then even how you're biting, it feels good when you bite down all the way?
Yeah.
Okay, perfect. So you would prefer the digital denture versus the one that I just delivered right now?
Yeah, this one.
Okay, perfect. Well, thank you, Omar. Thank you for watching. This has been a presentation by Helix Dental, located in La Mesa, California. We appreciate all the help from Vita North America, and for all the awesome modules that Aman Gerbach has. The Ceramill Motion 2 is actually what we use to mill out this denture, which can actually mill titanium, PEEK, PMMA, wax, different types of hybrids of lithium disilicate and lithium disilicate itself, so that's awesome. For more information, you can contact Vita North America and also Aman Gerbach directly. If you have any questions, let me know. This has been an awesome experience to be able to work with dentures digitally, and it's opened up a lot of doors for other procedures as well. It's awesome that everything can be done digitally nowadays and fully integrated into the dental office and work environment. Stay tuned for more, and thank you again.